Hi, I'm Steve Derbyshire. I'm an ENT surgeon with a special interest in head and neck cancer.
Hi, I'm Jo Lynch. I'm a consultant clinical oncologist and I also treat people with head and neck cancer. So in the previous video we've done a general introduction into head and neck cancer and the sort of symptoms that people might present with. In this video we're going to talk in a little bit more detail about the surgical management of head and neck cancers. So Steve, just to start off with, what is the role of surgery in the management of head and neck cancer?
So the first role of surgery is in the diagnosis of head and neck cancer. We very much need, if we suspect a cancer, to get a sample, in other words a biopsy of the tumour. And often that requires a general anaesthetic and a short procedure that's done as a day case to get a specimen of the tumour, which is then sent off, looked at under the microscope by a pathologist, and that aids us in getting the diagnosis.
Okay. And once you have the diagnosis, which types of head and neck cancer do you most commonly then go on to operate on in terms of part of the treatment? Okay,
so the majority of head and neck cancers have a surgical role, but certainly thyroid cancers and salivary gland cancers, the mainstay of treatment will be surgical excision. Cancers of the lining of the throat, depending on their position and how advanced they are, occasionally have a surgical role, but most often probably have a combination treatment of chemotherapy and radiotherapy.
So if I was to go through an operation for a head and neck cancer, how long would I expect to be in hospital for?
It's really varied. A small cancer of the thyroid, it could be a 90-minute operation with an overnight stay, all the way through to 3 or 4 days or even longer in hospital. The key point with all of this surgery is you'll receive lots of support. You'll have close contact with your surgeon who will take you through the risks and benefits and alternatives to the surgical intervention. And there's also a wider team, including oncology, but also speech and language therapists and dietitians to help aid you through your treatment.
Okay, and in terms of the rehabilitation after the surgery, how long afterwards do you think it takes to recover from the surgery, and are you likely to go back to normal, or does that depend on the operation?
Again, it's really variable. Some of the smaller operations you'll be back to normal within days, but some of the bigger operations, it can affect your swallowing, it can affect your speech, and if you need further treatment, and often radiotherapy or a combination of radiotherapy and chemotherapy is needed, then the rehabilitation can take longer. The key point is you'll be supported through that journey.